The next portion of the talk, I will be talking about telehealth platforms and best practices for providers. In this section of the talk, the objectives are that the learner will be able to execute best practices for conducting a telehealth video visit. Another objective is that a learner will be able to compare and contrast the different telehealth platforms. And a third objective is that the learner will be able to implement telehealth in their own practice. In regards to best practices for conducting a telehealth visit, the most important thing to remember is the standard of care for a telemedicine visit remains the same as the standard of care for an in-person visit, so the quality of care should stay the same. One thing you should do before a telemedicine visit is make sure that patients can connect. You want to ensure that they have the technical requirements for connecting. And ideally, you would like a member of the medical team or perhaps yourself to conduct a test call prior to the patient encounter, if at all possible. It's also important to remember to dress professionally. There is a temptation when you're working from home not to dress professionally, but it is important because you want to simulate an in-person visit as much as possible. So what some people will do is that they might even wear an ID badge to simulate an in-person visit. Another important thing, as we discussed before, is to have a backup plan if there's a technology failure. So ideally, you'll have technical support, you'll have a backup video option, and you should also have a phone number for the patient in case of a technical problem. When I first started doing telemedicine, I wondered if I would have to do anything differently in a telemedicine visit as compared to an in-person visit. And for the most part, it's pretty much the same. But there are some things that you may want to change to make it better simulate an in-person visit. So you can't obviously shake a patient's hand. So what you may want to do is replace that with small talk and chit-chat. Another thing is to better simulate an in-person visit, you may want to have a more in-depth conversation than you normally would have if it was an in-person visit. You might also want to allocate more time for the visit. And usually you might need this, especially if the patient is new to telemedicine or if there's some technological issue. And this does tend to happen a lot when the patient is new or the provider is new. But when the provider and patient become used to it, it tends to go faster than an in-person visit. You should also be mindful of the setting and the room that you are doing the telemedicine visit in. So it should be a private room and it should be well lit. You don't want too much backlight. Again, you want to be professional in the way you dress. And it is helpful to incorporate some public speaking and broadcasting skills when you're talking to a patient through telemedicine. So you'll want to project your voice and you'll want to enhance your gestures. Another important thing is to remember to look into the camera and not into the patient's eyes. Because if you look into the camera, it'll look like you're looking into the patient's eyes. And lastly, one thing you may need to do to adapt your practice is if the patient is actually going into a facility to talk to you through telemedicine, you may need to teach the staff over there how to check physical parameters that you yourself can't check. So there may be some extra training that is involved. For this part of the talk, I've been asked to compare and contrast popular telehealth platforms. I am not endorsing any of these telehealth platforms. I'm merely just mentioning them. I actually don't have any personal knowledge of these platforms, so I don't know. It's all research, basically, and I can't speak to how good they are personally. So one of the popular platforms is Mend. A positive for this platform is that it's easy to use and it minimizes the screens that are needed. A negative is that there is no free trial. So a lot of platforms will give you a free trial so you can test it out. Another popular platform is DocSeeMe. This is, one that is used often because it's free to use at the lowest tier. A negative is that there are no mobile applications, so you can't use it on a smartphone. Another popular telehealth program is AMC Health. A positive of this platform is that it focuses on health monitoring, so it allows you to operate remote devices for sending biometric data, like electronic stethoscopes. And negative is that it has opaque pricing. You can't really look at the pricing online. You have to call a salesperson. And a fourth platform I'm going to talk about is Teledoc. So this system is different than the other systems. It's not like a platform that you would buy for your own practice. The way this works is that a physician will work for this company as an independent contractor, and they are paid per consultation. So it's a totally different system. So that brings us to, what is the future of telehealth? In the past year, during the COVID-19 pandemic, there have been unprecedented and swift changes that have been made, resulting in expanded services and relaxed regulations. The question is, will these changes continue after the COVID-19 public emergency? A lot of that will depend on whether the barriers to continued growth are addressed. So for example, the regulations that were existing before the COVID-19 pandemic may be reinstated, and that will slow down the growth of telemedicine in the future. Another issue is coverage and reimbursement, which is very complex and far from uniform. So one thing that might help is to have standardization across states for coverage and reimbursement for telemedicine. And lastly, another thing that could be a barrier is the telecommunications infrastructure and limitation of internet access in certain regions of the country, like rural areas or low socioeconomic areas. So if we want to make sure that telemedicine is used in these areas, it may require an investment of money and resources to improve telecommunications infrastructure in those regions and to provide education for people in those areas on how to use it. In case you want to look at telemedicine going forward, there are some very helpful resources online that I use for my presentation and for information. One of these is the American Psychiatric Association Telepsychiatry Toolkit. Another is the American Telemedicine Association. Another one is the Center for Connected Health Policy. And the Henry J. Kaiser Family Foundation has been very helpful for resources about telemedicine as well. Thank you. Have a good day.